we are joined by Dr. James Hildreth, President and CEO of Meharry Medical College. Dr. Melissa McFeeters, Professor of Health Policy and Co-Director of the Center for Improving the Public's Health Through Informatics at Vanderbilt University Medical Center, who is joining us by WebEx video conference, and Bart Herbison, Executive Director of Nashville Songwriters Association International, who is also joining us by video conference. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Yesterday's attack on Fifth Avenue South is a tragedy. And this was an act of cruel and senseless violence. And my thoughts are with both victims as they continue to fight for their lives at Vanderbilt University Medical Center. And I am grateful to the responding officers of the Metro Nashville Police Department for their swift, life-saving actions. Now, I want to thank everyone who's continuing to observe Metro's public health orders throughout Phase 1 of our roadmap, including restaurateurs and other small business owners who are taking steps to protect their staff and customers, and all residents who are wearing masks and keeping a safe distance from one another as they begin to re-engage our local economy in slightly different yet familiar ways. Now, since our last briefing on Thursday, we've seen a daily average of 51 new confirmed cases. Now, our thoughts are with everyone who's tested positive with the coronavirus, and we wish them a speedy and complete recovery. But we have seen further stabilization of our 14-day new case trend, transmission rate, and other important metrics that advance us closer to the start of Phase 2. Now, of course, our thoughts are with everyone who's fighting the coronavirus, but these are encouraging numbers, and I urge everyone to stay the course, to safeguard your health, and to protect those around you. As I've mentioned before, we are on familiar terrain and do not have all the answers, but we have a coordinated effort to have the right answers for the questions we encounter. The Metro Coronavirus Task Force is working diligently with business and community leaders as we collect and carefully consider your feedback on the roadmap for reopening Nashville. Please continue to submit your comments through the Metro COVID-19 website and let us know how your reopening strategy can best serve your business or organization, employees, volunteers, customers, and clients, while protecting public health. 2 weeks ago, the Metro Public Health Department distributed our first shipment of 25,000 reusable cloth masks from the state's COVID-19 Unified Command. This past weekend, Metro Public Health, the Office of Emergency Management, and Hands On Nashville distributed over 20,000 masks at the Metro Southeast facility on Murfreesboro Pike. Additional mask distribution dates and locations will be announced later today. Now, last week's Vanderbilt's COVID-19 modeling team reported that Tennessee will stay below mathematical models that previously estimated 1,200 concurrent hospitalizations by mid-May. This morning, I want to welcome Dr. Melissa McFeeters, Professor of Health Policy and Co-Director of Sci-Fi at Vanderbilt, who is joining us remotely to discuss this updated modeling and what we must do to maintain the flattened trajectory of the COVID-19 curve. I also want to welcome Dr. James Hildreth, President and CEO of Meharry Medical Center, who's with us this morning to provide his insight as a community leader, educator, and infectious disease expert on the effects of COVID-19 and our community's response to the disease. Now, Nashville has a rich history of both consoling and encouraging our neighbors far and wide during tumultuous times with the gift of music. In fact, it could be said that our very own 650 WSM AM was one of the world's first virtual communities. And debuting here in Nashville on October 5th, 1925, families across our region gathered around their radios for a shared experience while listening to programs such as WSM Barn Dance, later renamed the Grand Ole Opry. Now, in recent times of crisis, Nashville artists created music that both challenged and inspired us all. In 1994, Reba McEntire addressed the HIV/AIDS epidemic in no uncertain terms. And in the aftermath of the 9/11 attacks, Alan Jackson helped put our nation's grief into words when the right words were so hard to find. From the war in Vietnam to the wars in Iraq and Afghanistan, Nashville songwriters and musicians have transcribed our troubles and triumphs. And now, in our fight against coronavirus, we could use an anthem to help us build solidarity and inspire us in ways that only music can. Music is essential, and here in Music City, we know that better than anybody else. Now, it's my pleasure to welcome Bart Herbison, Executive Director of the Nashville Songwriters Association International. And Bart has joined us by video conference to announce a COVID-19 songwriting competition that will help carry on Nashville's tradition of inspiring the world through three chords and the truth, to use the immortal words of legendary songwriter Harlan Howard. Now, as we prepare for phase 2 of our roadmap, I urge all Nashvillians to remain vigilant. Remember to practice safe social distancing, wear face coverings in public settings, and frequently wash your hands. We will continue to use appropriate enforcement actions to protect public health. Fines, revoked permits, and civil penalties will be used to keep workers and customers safe. By protecting public health, we will maintain consumer confidence in our businesses and uphold our city's reputation for safety. This will provide the foundation to a sustained economic restart. Now, if you suspect you may have symptoms of COVID-19, do not hesitate to call Metro's COVID-19 hotline, 615-862-7777, from 7 a.m. to 7 p.m., Monday through Friday. Our assessment centers are also open 5 days a week from 9 a.m. to 3 p.m. And as always, please consider making a contribution to the COVID-19 Response Fund or visit Metro's COVID-19 website to learn how you can obtain direct financial, food, mental health, and social service assistance. I'll now turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest of coronavirus in Davidson County. We now have a total of 4,160 confirmed cases. That is an increase of 28 over the past 24 hours. 1,254 of these cases are active, and 2,863 residents have recovered and have been cleared. We did not have any deaths in Nashville since I last spoke with you on Thursday. Thus, 43 Nashvillians have died as a result of COVID-19. Now today, the 14-day rolling average of reported new cases is 69. Last Monday, this average was 87, and the Monday prior to that, the average was 92. Now this is a good trend for us to see. The transmission rate for Nashville is also now below 1 again. This means that the spread of the virus is slowing in our community. Now this week, we also continue to increase public health capacity. At the beginning of this pandemic, Metro Public Health Department had only 4 investigators. As of today, there are over 120 individuals. These resources will help us further investigate and isolate clusters that appear and slow the spread of the disease in our community. Last week, we conducted 6,488 COVID-19 tests for Nashvillians. This is well above our goal of 4,600. Since mid-March, 44,212 Nashvillians have been tested for this virus, and 9.4 of those tested were positive. We have been at or below the 10% mark now since mid-April, and this shows that we have a good sense of the severity of this disease, and that the outbreak in our community appears to be stable. Now, our hospital capacity in the region also remains adequate. Hospital beds this morning are at 34% available, and ICU beds are at 29% available. Now, this morning, for the first time, all 6 of our key metrics are green or satisfactory. Now, this is encouraging news. However, we are not out of the woods. The COVID-19 virus we are facing today is exactly the same disease that we were facing 2 months ago. Then we were seeing news of overrun hospitals and deaths in hotspots all over the country. We heard of estimates of how many would be infected and how many would die, and some of those estimates were extremely high. In fact, here in Nashville, we were planning for a 1,400-bed auxiliary hospital at the Music City Center. Now, the virus is the same as it has been in March, but what has changed? What has changed is this, Nashville. You all embraced the safer at home. You helped us flatten the curve. You stayed at home and went out when it was only necessary, and you wore your face coverings out of respect for others. And you stayed apart and took care of our most vulnerable. Now, as we continue to open up our city, we can go out more, but remember, the virus is the same virus as 2 months ago. It can still have a devastating impact on our community unless we continue to fight it. Now, we will carefully examine the data in the coming weeks, and the data and science will guide us as it has throughout this crisis. So please remember to stay focused and keep doing your part. Stay at home and only go out if absolutely necessary. Wear face coverings. And again, let me say this again. Please wear your face coverings and keep your distance. I really appreciate everything you have done to this point, and I look forward to hopefully much more success as we're moving forward. I now would like to introduce Dr. James Hildreth of Meharry Medical College. Thank you.
Good morning, Nashville. Today, I'd like to share with you the normal process of developing a vaccine and try to put into context the enormous challenge of doing so in a year or less. Today, as I stand and speak with you, hundreds of millions of people around the world are being injected with a vaccine, taking a pill, or being infused with a drug. These vaccines and drugs have saved millions of lives. They've extended life expectancies globally, but all of them underwent a series of tests and evaluations before they were approved by the FDA or by an equivalent agency in other countries. In the case of vaccines, there are usually several stages of development. The first stage is what is happening now, that of discovery, where we try to learn as much as we can about the biology of the virus and the immune response to it. That follows by the preclinical stage of development, in which we do laboratory studies with the virus, with cultured cells, and sometimes we test the virus in animals such as mice or monkeys. If the results of the preclinical stage are encouraging enough, we move to phase 1 studies in humans. Phase 1 studies are where we try to evaluate the safety of a vaccine candidate, and normally that involves 20 to 100 volunteers. And what happens is these volunteers get the vaccine candidate and they're monitored for adverse consequences of any kind to make sure that the vaccine is safe. This usually takes several weeks to several months. If the vaccine candidate passes the phase 1 safety test, it moves on to a phase 2 trial. This normally involves hundreds of volunteers, and the goal of the phase 2 study is to confirm the safety, but now to ask the question, does the vaccine elicit the immune response that we'd like it to? Because there are large numbers of folks involved in a phase 2 study, it normally happens at multiple sites. Typically, as many as 10 to 20 sites might be involved in such a study. And if the phase 2 results are satisfactory, we move on to a phase 3 study. This one involves thousands of volunteers at multiple sites, and the coordination of such trials and the logistics can be quite complicated. And the goal of the phase 3 trial is to answer that question that the vaccine is meant for the purpose of the vaccine, which is, does it elicit an immune response that protects against the virus? This phase can also take several months. Sometimes it can take a year or more. The FDA normally requires that all 3 of these phases be completed before a vaccine is approved. And since many of these phases, all of these phases can take months, you can actually see why it'd be very hard under normal circumstances to produce a virus vaccine in less than a year. And even after all those things are done, there's still more stages of development. There's a regulatory and approval stage whereby a group of experts come together on behalf of the FDA to review the results and decide whether or not the vaccine can be approved. Then there's the manufacturing process that needs to be established at a large scale, And we got to make sure the quality control is in place to make sure the batches are appropriate. So even if the FDA approves a vaccine on January 1st of 2021, there's going to be the daunting challenge of producing hundreds of millions of doses that will be needed to protect the U.S. population. And quite honestly, depending on the type of vaccine that is chosen, we honestly don't have the capacity in the country at the moment to produce a vaccine at that scale. But having said all that, there still remains a really important question that we still haven't answered, and that is, what kind of immune response is most effective against the COVID-19 virus? Are antibodies alone enough, or do we need the other arm of the immune system, the killer T cells, to be involved as well? That question is being studied at many places, and we will have an answer. My point is that it may take us a while to develop an effective vaccine against COVID-19 virus, SARS-CoV-2. So we need to get comfortable with the idea of doing mitigation for many months to come. And Nashville, as Dr. Jahanger said, compared to some other cities, we've done a great job of mitigating the virus, and we need to keep it up because we're going to be at it for a little while. And let me just say something I said before. Businesses may reopen, the economy may restart, but each one of us need to be vigilant to protect ourselves, and by doing that, we protect the whole community. So Nashville, we got this. Let's keep it up. And please, 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 don't be a vector for COVID-19. And with that, I'd like to turn it over to Dr. Melissa McFeeters from Vanderbilt University Medical Center.
Great. Thank you very much for having me with you today. I'm going to share a file. Tennessee is now in a new phase of addressing the COVID epidemic as businesses are reopening and moving toward full capacity. Last week, our team released new numbers that we will track to identify any shift that may occur as the state reopens. Remember, with an incubation period of a few days to 2 weeks, cases at any given time reflect a lag in actual infections, and severe symptoms requiring hospitalization are even further lagged by about a week after initial onset. Therefore, it is essential to remember that what we are sharing today are baseline numbers. It is too early to assess any impact of opening businesses. In really good news, since our initial report at the beginning of April, Tennessee, including Middle Tennessee, as you have heard, has reduced the transmission number from 1.4 to right around 1.0. As we shared in our April 16th modeling report, the state achieved this statewide transmission number by about mid-April, a month before our original continued progress scenario anticipated. Our goal now is to continue to reduce the transmission number to be consistently below 1.0 and to sustain it there for an extended period of time. That said, we continue to see both cluster outbreaks and community spread of COVID across the state and in Middle Tennessee. With a transmission number around 1.0, growth in cases is substantially reduced, but we should carefully track areas that have higher numbers of cases. As you can see in the heat maps that we have on our website, some areas have experienced a relatively higher number of new cases in the past 10 days, even though numbers are down overall. Fortunately, we have a strong and prepared health system in Tennessee, and from this point, we are able to manage the numbers of cases requiring hospitalization. As of May 11th, there were 275 hospitalizations for COVID-19 across the state. About half of these required care in an intensive care unit, and about 20% were on a ventilator. Here in Middle Tennessee, about 140 patients were hospitalized. These case numbers have continued to drop slightly in the past week. We had about 260 hospitalizations across the state at the end of the week. Of note, with a transmission number at 1.0 in our April 24th report, our underlying estimate was that the number of people concurrently in the hospital would plateau right about 250 to 300 statewide, which is what we are currently seeing. We continue to stress that with a transmission number of 1.0, the epidemic continues, but at a simmer. Our success is real, but it is fragile. Any single case can be the spark that sets off the wildfire. And we have seen this happen in other countries that have initially contained the epidemic. Therefore, we're going to continue to stress the importance of tracking the data carefully and of supporting a very strong public health response based on the concept of test, trace, and isolate. Thank you.
Thank you, Dr. McFeeters. I'd now like to introduce Bart Herbison, Executive Director of Nashville Songwriters Association International.
Thank you, and Mayor Cooper, thank you for your leadership, and to all of our medical professionals, first responders, all the individuals and organizations out there helping us navigate this unprecedented situation. Thank you. So, songs are supposed to make us feel something. The music marks the moments in our lives, and I said from day one, songs will help us emotionally, spiritually get through this pandemic. I got a call a few days ago from Butch Spiritum, the CEO of the Nashville Convention and Visitors Corporation, and he said, Mayor Cooper says Nashville needs a song. And he was right. So we immediately rallied, and things that would probably take us days and days and days to get together, we put together in a few hours. And about 100 songs were submitted for Nashville Needs a Song, and several hundred songwriters, because they co-write, were involved. We are down to the final 4, and I have to tell you, as we went through these, the final judging will be tomorrow with a panel of incredible professional songwriters. I was so moved. It's going to be hard for us to decide which of these songs will sort of be our anthem, but they're amazing, and I've never been more proud of the songwriter community, so I look forward to the public hearing these later on. And one of the things we ask is at least one of the writers on each song be from Davidson County. So Nashville songwriters really step forward, and I think everybody's going to be moved. It's going to help us navigate, and I've never been prouder to lead the songwriter community here in Middle Tennessee.
Thank you, Mr. Herbison. Let's begin today's Q&A session with Jeremy Finley at WSMV. Jeremy.
Good morning. Thanks again for taking our questions. What I wanted to ask is, over the weekend, if your investigators with the health department had found any businesses that were violating the order, if this is the week that you will start passing out fines for employees who aren't wearing masks. Just trying to get an idea of where you are with your investigations into businesses. And also wanted to ask if the health department and the city are hearing a lot of frustration from businesses as the outer counties have opened up, that they are losing a substantial amount of businesses to people leaving the county for places that are opened up. I wanted to gauge and see how many complaints the city was hearing from businesses about their lack of business and people leaving for businesses outside of the county. Thank you.
Thank you, Jeremy. We'll start with Dr. Caldwell.
Good morning. We've received approximately 400 complaints since entering phase 1. Whether you're using your smartphone, get Hub Nashville, contact 311, or go to the covid19.nashville.gov website. Most of these complaints are about employees not wearing facial coverings or not wearing them properly. So we are following up with each one of these businesses. And what we're finding out is that a lot of these businesses just didn't really understand the rules. We will be continuing our education and observations this week. If we find that after we've already communicated with the business that they continue to not be in compliance, then we will start fining. We have issued 4 citations previously, and we will not hesitate to do it again. Thank you.
Thank you, Jeremy. Yeah, of course there are frustrations when there's not a completely consistent response. But here in Nashville, we have more disease. A quarter of the cases in Tennessee have been in Nashville. So I think the surrounding counties and the state should be deeply grateful that we have managed to have qualified success here. We want to get through this phase, get on to phase 2. We do not want to relapse. Being kind of the central county for the region, it is very important that the disease be controlled here because we can spread it back to other counties. But other counties also are responsible for social distancing. Everybody in Tennessee is responsible for social distancing. All of us are responsible for keeping each other safe, and we're for sure going to do that here in Nashville, and other counties for sure are going to do that there, and then together we'll get to the other side of this pandemic.
Julia Palazzo, WKRN. Julia?
Good morning. Excuse me. Thank you so much. A couple questions. Mayor Cooper, when will you all announce this week when you'll move into phase 2, or if you will on Monday, I should say, so businesses have time to prepare? And, with the nice weather this weekend, obviously a lot of people were out about. Is transportainment on Broadway part of phase 1?
Sorry, Julia, you're breaking up.
Because I had a couple
Julia?
of people see. Oh. Hello?
Could you repeat the second part of your question, please?
Yeah, just wanted to ask if transportainment on Broadway is part of phase 1 of reopening, because of the nice weather, some people did see them out this weekend. And if you could still hear me, just one more question quickly for either Dr. Jahangir or Dr. Caldwell. If a person tests positive for COVID-19 or someone came into contact with someone who tested positive and they don't respond to a contact tracer, is there some type of punishment for that or consequence? Thank you.
Thank you. The first part of the question was about phase 2 start date. And we'll start with Dr. Jahangir.
Julia, I'm going to try to answer the first two parts of your question. As we did with going into phase 1, we agree that there needs to be some warning or some awareness given to our colleagues on the need to expand their businesses. So we'll watch the data over the next couple of days as well, and then we'll evaluate that, and probably later this week make sure we announce if we're rolling into phase 2 and on what date and what means. Regarding I think you said the transportainment, they are not currently in phase 1. They coming out in future phases will have more defined point and when they can be in there, but they're not currently in phase 1. And I'll defer to Dr. Caldwell for number 3.
You bring up a good point about our contact tracers and trying to reach everybody very quickly. We will use every means necessary to be able to reach out to individuals by phone, by mail, by personally delivering a summons to their home. We have found some people are difficult to reach, and we have found that when we have provided information directly to somebody's home, that they do follow up with us. Everybody we have talked to, for the most part, has been cooperative. If people are not cooperative, we try to find ways that we can build trust with them so that they can be compliant. We have not fined anybody for not speaking with our contact tracers at this time, although that is something that we can consider if we feel that we're having a problem with compliance. Overall, everybody is very pleased to be able to assist and assure that not only can they talk about their positive status, but they can protect others. They can let us know who they've been in contact with, and we're seeing overwhelming majority of people wanting to cooperate with us. Thank you.
Milt Capps with Venture Nashville Connections. Milt, you're on the air.
Yeah, thank you. Given that was, as was said earlier, that our success is fragile, I think some Metro staff are aware that a company recently, an analytics company in healthcare, recently warned us that increased infection in outlying counties, nearby counties, could help trigger a second wave in this region. And apart from monitoring their numbers, what is Metro doing proactively to coordinate with counties about mobility and contagion across counties?
Okay, thank you, Milt. Dr. Jahangir?
Thank you, Milt. You know, in short, you know, we are setting our the rules that make sense for us. And as we were the first, as we did when Safer at Home was placed in, you know, Mayor Cooper announced Safer at Home and coordinated with our regional counties and then all the regional counties and put in a Safer at Home. We're hoping as we're doing this opening that the counties can do it again. But understand the counties in the surrounding area really are under jurisdiction of the state of Tennessee. And so we are coordinating with the state of Tennessee. I speak with Commissioner Ezel's group and Commissioner Ezel several times a week. And but every individual, I just want to be very clear, every individual, whether you live in Nashville or surrounding county, is responsible for the health of the community. So my statement to businesses, to individuals, is do the things we keep talking about. Wear masks, social distance, don't patronize businesses that you feel are not safe. That message should be across borders, across counties, and that's our efforts. Thank you.
Those are all the questions we have this morning. I'd like to thank Dr. James Hildreth, Dr. Melissa McFeeters, and Mr. Bart Herbison for participating in today's press briefing. The next scheduled Metro COVID-19 press briefing will air on Thursday morning, May 21st at 9:30 a.m. Regular press updates, including data from the Metro Public Health Department, will be emailed daily to local media. As a reminder, you can stay up to date on Metro's coronavirus response at covid19.nashville.gov. Thank you for joining us. This concludes today's COVID-19 press briefing.